Hello everyone, you are all welcome to lecture number 1344, and today's topic is the bloating epidemic, its causes and solution. So bloating is very common, especially in senior citizens, and it can happen to even young people, anybody. And it is a digestive problem accompanied by gas, abdominal pain, feeling, sensation, anxiety built up, hysteria, vomiting. All these things are related to your bloating epidemic. I call it epidemic because definitely it has lot of serious issue once it is in chronic condition. So we should not take it lightly. Definitely it is serious digestive disorder where we get butterfly movement, some air inside the stomach, some movement of watery material. So it clearly indicates that our digestive system is not functioning properly and the response is poor, and it is retaining water. There is retention of water rather than to absorb all the food material, ingredients including water, and it is supplied to your blood and body. So the retention of water is serious matter, and because of that it is a triggering factor. You get bloating and gas formation. So what are the factors responsible for this? First is your lifestyle, eating habit, and identifying the type of food. So you have to identify what are the different types of foods which are responsible and causing the bloating. So the foods which are causing the bloating, mainly first one, that is your legume and beans. If I talk in Nigerian language, it is beans, different type of beans, soya bean, colored bean, white bean, brown bean, all are legumes. If I talk in terms of Indian language, it is lentils. Lentils mean dale. Matar. Matar is also type of legume. Then urad ki dal, arhar ki dal. They are all very much gas producing, and there will be digestive problem and you will get bloating. And also there are some vegetables. They are known as the vegetables which belong to cruciferous family. So the cruciferous family means all vegetables like cauliflower, cabbage, and all the related vegetables under cruciferous family. They are responsible. Also radish and some other hard fiber. And if you are taking hard fiber in large quantity, that is also causing problem of bloating. And the symptoms are of two types. Once it is moderate or less bloating, then only there will be gastric problem, abdominal pain, and it can be suppressed by taking some medication to settle the stomach disorder and butterfly movement. But in case if it has gone to chronic condition, then the symptom will be vomiting, also abdominal pain and severe pain, Also, in stool there will be traces of blood. If such conditions are coming, then you have to go to seek the advice from your doctor. It means it is in chronic condition, and if that condition is there, then definitely you will be having deficiency of lot of nutrients, including vitamin, mineral, and they are not absorbed by your digestive system, intestine, because it is not working properly. It's all in the form of bloating with retention of water and gas, and absorption is not taking place. So such people who are having chronic condition, bloating, they will be having deficiency of all these vitamins and minerals. Also, there is a mental issue. They will be suffering from depression. They will be suffering from anxiety, concentration. So it is very much, we can say, harmful to our normal well-being and health. Now, what are the foods we should take to avoid such type of health condition that is called bloating epidemic? So the foods are ginger, that is adrak, then peppermint containing food, green leafy food, mild, not complex, simple fiber, probiotic like curd, but of course don't go for milk, because the other type of foods which are sensitive means our digestive system may not be tolerant, because there are some people where they are not ready to tolerate some foods like your milk, because milk contains lactic acid, lactose. So some of them are lactose intolerant. Wheat or gluten. The wheat is the rich source of gluten. So some people may get bloating because of the intolerance to gluten. So these factors you have to identify yourself. You have to understand their characteristic of different type of food, which one is good, which one is bad. Let me show you some of the images. Now you adjust. So here the image is, you can see the red surrounding our stomach and abdomen. That is actually the symptom of bloating. You have stomach irritation as well as abdominal pain. It shows that it is mild bloating. Once somebody is having chronic bloating, then he has to go and will be hospitalized, because he will be having lot of different symptoms. It will be reaching to your chest, to other side, and you will be having the doubt of whether kidney is involved or heart is involved. So only the doctors will identify that it is all gastric and bloating problem. It has nothing to do with your kidney or with your heart. That is big confusion comes once you are suffering from bloating. These are all foods. They are known as anti-bloating foods. They are listed here. In this you can see broccoli is there. Your berries are there. Ginger is there. Green leafy vegetables are there. So all these things, they are anti-bloating vegetables. Peppermint is also there, and so many others you can identify. Banana is also there. So if you take all these, add in your diet, your bloating problem will be solved. So here two group of foods are shown. One group, that is when you are taking it will reduce the bloating condition, and these are given here. Kiwi is there, and also some greenish vegetable is there, probiotic is there. That is what it is going to help to your bloating problem. The other side is the other foods, which are mostly processed refined foods, junk food, carbonated drink. All these are going to aggravate or increase the bloating symptoms. So here, what I have already told you, I am giving here in the form of summary. So number one, bloating is a common digestive issue. It stems from the gas, poor digestion. Bloating is characterized by a feeling of discomfort, tightness, and pain, swelling of abdominal area. Number two, the symptoms of bloating. First symptom is swelling of abdomen. B, pain in abdominal area. C, formation of gas. D, flatulence, means feeling like air trapped in our digestive system. That is called butterfly movement. And that I have already told you is because there is retention of water and all the material is not properly absorbed. That's why you get such type of condition that is called bloating. Then number three, causes of bloating. What are the main causes of bloating? A, swelling of, swallowing of air. Once you are eating very fast, very quickly. So during that process, you are swallowing a lot of air is going inside. That is one factor. B, food intolerance. There are some foods your digestive system is intolerant. I have already told you, like milk, like some wheat, or the food which is containing gluten, and some other also, and you can feel yourself. So avoid such type of food which is showing intolerance by your digestive system. C, eating habits. Slow eating, chewing is the best way. Don't be very fast. Hormonal change. Yeah, especially it is in female. Once she is having pregnancy or menopause, during that time there is drastic change, fluctuation of hormone, that is female hormone, progesterone or estrogen. Because of that, bloating starts. And then E, medical condition. Medical condition means irritable bowel syndrome. That is called medical condition. Those who are having irritable bowel syndrome, they will have this bowel movement, that is irritable bowel syndrome. Number 4, harm to health. It is harmful to your health. Chronic bloating can have significant role on the quality of life and overall health, like discomfort and pain. Always you will be feeling discomfort in your abdomen, in your stomach side, and always you will be feeling dull and lazy because of such type of pain. B, nutrient deficiency. I have already told you, once you have bloating, your vitamins, nutrients, minerals will not be properly absorbed, and such people who are having the condition of bloating will be always deficient in vitamins and minerals. Then C, mental health problem. Those who are having bloating, they will be having depression and anxiety because it is triggering factor of such condition, mental condition. The sleep disturbance. once you have bloating, you will be having during night sleep disturbance. Sometimes you will get up because of pain and discomfort. Then E, reduce productivity. You will be always feeling tired and lazy, and it will affect your work and productivity. Then when to seek medical attention, to go to doctor, in what circumstances and condition, is when you start vomiting blood, when you get blood in your stool, when your breath is short, breathlessness, and that is called difficulty in breathing, and fever 101.5 degree Fahrenheit, or we call it 38 degree centigrade. Now, foods to avoid so that you are not having bloating. So those foods what you are going to avoid, I have already told you, they are bean and legume, cruciferous vegetable like cabbage, cauliflower, and then second is dairy products, those who are intolerant to the lactose. Then wheat and gluten. Wheat is rich in gluten, avoid it. Those people who are having sensitivity to gluten, or we can say intolerant. 4, carbonated drink. Carbonated drink means soda and some other where lot of pressed carbon dioxide gas is there. And once you are taking, it is going to add more and more gas, that is CO2. It is harmful, and it will aggravate the condition of bloating. And then avoid chewing gum. Chewing gum is also one of the factor, especially in young children, to have bloating. Then number 6, always stay hydrated. If you are always taking enough water, it is going to take care of bloating. So always keep hydrated. Exercise regularly, and manage your stress. Mental tension and stress is also a problem. Add to your foods to reduce bloating. What are the foods you should add? They are ginger, peppermint. Peppermint is so important to reduce drastically the bloating, that we call in India pudina. Pudine ka capsule. We get peppermint capsule in India, that in the form of extract, liquid form. And that is very good for controlling the bloating. Then pineapple, banana, simple fiber, yogurt, probiotics. Probiotics means those foods which are fermented. Cucumber, that in Maiduguri it is called gulli. And fennel. Fennel is the English name in India, that is small seed. It's called saunf. Papaya means papita. Popo here in Nigeria we call it. And chia seeds. So they are all very good food which you can add, and there are foods which you should avoid so that you are not having the bloating syndrome, or we call it bloating epidemic. So with this, I will stop. And in the last but not least, your eating habit, your lifestyle, your discipline plays important role to reduce the bloating epidemic or syndrome. Once again, thank you very much for watching the lecture.